Good evening, and welcome to Join the Discussion, a monthly show about senior health and aging. My name is Madelene Francese. I'm the Vice President of Marketing and Strategy for Heber Senior Care, and I'll be your host. Tonight, we're going to talk about Alzheimer's and dementia. It is scary. If you ask people what disease they are most frightened about now, they go past heart disease, although it is still important. They go past cancer. They go past many of the diseases that we do worry about but made advancements around. And most people now will list Alzheimer's and the forms of dementia as the disease they are most frightened about. The fear is with good reason. Today in the United States, more than 5 million people are coping with this memory-robbing disease. That number could triple by 2050 to over 15 million. Closer to home, in Connecticut, today, 77,000 people wake up having to cope with this illness. Tonight, we're going to speak to Christy Kovel, the Interim Director of the Connecticut chapter of the Alzheimer's Association. She is also the Director of Public Policy for the chapter. She has more than 25 years in senior provider services, but her passion is grassroots public policy and advocacy, fighting for people who are vulnerable. I am so glad to welcome you tonight, Christy, and I know you have a wealth of information about this topic.
Thanks for having me.
Well, let's get right to it, because we only have 28 minutes. And I have a lot to ask. So I want to start from the beginning for the audience. Let's frame the conversation. So what is the difference and the definitions for Alzheimer's versus dementia? And I hear, are there more than 70 different types of dementia? Which sort of was a startling fact.
Right. So, and that is a wonderful question to start with. Thank you for having me on. That is an important question. So when people say, what's the difference between dementia and Alzheimer's? Dementia is the umbrella term. You can be diagnosed with dementia. It's a collection of symptoms. Alzheimer's disease is a type of dementia. It accounts for about 60 to 80% of cases.
Which is why people probably refer to it as the overall. Okay.
Exactly. But there are other types of dementias. There's Lewy body disease, Huntington's disease, Pick's disease, vascular dementia. So there are different types of dementia. And in terms of diagnosing, we can diagnose now with probability when someone's still alive. You know, years ago, it was diagnosed only on autopsy. But generally speaking now, we recommend that someone get a full workup. Because we can diagnose Alzheimer's pretty much when someone is alive now.
Now, the other kinds of dementias that you just mentioned, Lewy body and such, have different symptomology, but still are accompanied by the lapse of memory and the memory impairment, or do they all symptomatically play differently?
They play differently. It depends on what it is. So, for example, Lewy body disease has typically people who have that have a lot more behavioral issues.
Okay.
They may exhibit different types of symptoms. You know, a vascular dementia also could be very, very different. Some, it may impact people who are younger. So it just depends.
Okay.
There's no real, they are a little bit different in terms of how they're diagnosed and symptomatically.
Okay. So senility. When I was a child, that was what we called it. Is that what dementia is in all its form, or is that word gone away?
It's gone away. I mean, I will tell you that my grandfather, you know, was diagnosed with senility too, or they sometimes called it senile dementia.
Right.
But that term is just generally not used anymore. They will use the term dementia. But generally they don't use that.
Senile was almost just an adjective, and they didn't know where to place it, so they used it as a diagnosis. Right. So mild cognitive impairment. Again, another form of dementia, or is that a separate category? Because you can have mild cognitive impairment from a TBI, having nothing to do with.
So mild cognitive impairment, it is the stage of normal aging, between normal aging and then cognitive decline.
Okay.
Typically, it's known as the precursor to Alzheimer's disease. So it's when someone's starting to have some memory issues, maybe not enough to impact daily life, but there's some symptomatic troubling concerns. They might go to a physician and get that diagnosis of MCI. So when they do, it's sort of a wake-up call as to what do I need to do next.
Does MCI date the diagnosis by years, months, or it depends on the person
It really
again?
depends on the person.
So it's really a moving target still, how it
is.
plays out in every individual.
It is. I mean, the
disease.
diagnosis process, that is the challenge here. So people tend to have changes in their brain oftentimes for many years before they exhibit symptoms. And as you know, I mean, you work with families and we work with families. Memory changes that disrupt daily life is the number one sort of warning sign for Alzheimer's.
And I want to stop you. It's not necessarily forgetting where your keys are. It's forgetting how to get to your house. It's forgetting the things that are, correct? I mean, let's for a second, because I know if you're watching, you're sitting here like I do and think, wait a minute, I forgot something yesterday. I couldn't remember where X was. Talk about what's normal forgetting and what's maybe forgetting you should bring up to your physician.
So, and that's a great question. So if people want to know more, I'm just going to plug
Yeah,
our website
please
first.
do.
ALZ.
Your website is wonderful, by the way,
.org.
and I encourage people to go and seek out help at the Alzheimer's Association chapter, please.
Thank you. ALZ.org/CT, the 10 warning signs.
Great.
So I think, and the number one is memory changes that disrupt daily life. And to your point, it's very, very common for people to misplace keys. We all walk into a room and then go, why am I
Why am I here? Exactly.
That sort of thing.
Not even the bigger question
No.
philosophically. Why am I here?
Exactly. It's more significant memory changes that disrupt daily life.
Okay.
So it's things like, so I always use the analogy like, you might misplace your car keys or forget something or not be able to find something. But if you're holding on to those car keys and you have absolutely no idea what they are or what you're supposed to use them for.
So form and function starts to get confusing.
Correct. Confusion with time or place. We all go on vacation, and a great vacation, you could say, oh, it's today Saturday or Sunday. If you are going to your loved one's house and it's July and the person has a winter coat on and they really truly don't know what time of year it is.
Right.
Something like that. People often notice changes around financial issues. You know, they'll notice that with their loved one, particularly with parents, older parents, bills might not be getting paid on
Hiding
time.
mail, I hear, is another sort of warning sign in that people start to think they're going to forget, so they put it someplace so they won't forget. And then they forget where it is. So
right. Well, it's
they're
overall cognitive kind of function. So it's things like being able to organize and pay your bills, memory changes, that affect daily life, communication and behaviors. Because if you're not able to sort of systematically, have executive function over your ADLs, like your activities of daily living, it's that kind of thing.
Okay, that makes sense. Is there an age for most people developing the disease? I know there's talk about early onset. What does that mean? And then what it would be, if you will, a normal progression for age for this.
So for somebody who has dementia or the diagnosis of Alzheimer's, age is the number one risk factor. The terminology of early onset or younger onset, which is what the Alzheimer's Association prefers it to be called, is a diagnosis under the age of 65.
Ooh. Wow, that surprises me. So under 65 is younger onset.
It is younger onset.
Okay.
Because it was called early onset, and then it was people were misinterpreting that with early symptoms. So,
got it.
So younger onset is more, it speaks to more what it is. So it's 65 and younger. Less common. About 200 people, 200,000, across 200,000 people in the United States have younger onset Alzheimer's or younger onset
Is there anything that unites those people? Is there a commonality in the people who get early onset, or no, not? We don't know that yet.
That's the frustrating part, no. And the challenge with younger onset is it could be genetic. There is some genetic causes around younger onset, but typically, the challenge for someone who has younger onset, if they're diagnosed under the age of 65, they may have, children at home. They still may be working, and this affects income, trying to manage, house and finances. And typically when people are diagnosed with younger onset Alzheimer's, the progression is much faster. We don't know why that is. So there are those challenges. Again, less common, but the impact is pretty significant. Age is the biggest risk factor for someone developing this disease. It's the #1 risk factor. We still estimate, the Alzheimer's Association estimates that 1 out of 2 individuals 85 and over may have Alzheimer's.
Are we seeing that now because we're living longer?
Yes.
The good news is our mortality rates are increasing, and therefore we're seeing the effects of that a little bit.
We are. I mean, if you think about years ago, people would work and they would retire, and then they may pass away 5 or 7 years later. And now, retirement, people are saying, it's like your next life, and people are doing all kinds of exciting and wonderful things. But with that comes the challenges of chronic diseases and living with chronic illnesses, the risk factor for Alzheimer's disease and/or care, and how people are aging in place in their communities.
Exactly. And I want to talk about the notion of dementia caring communities, but I'll get to that in a second. So can we for a second talk about research? That seems to be the real frustration here, and I believe out of the diseases that are in the top 10, Alzheimer's is, I think, number 5, but it gets the least amount of research money. And every day you hear new theories, and the one that really caught my eye was the one that we heard a couple weeks ago, linking gum disease and the gingivitis bacteria, and that they seem to have, and maybe I was just reaching because I wanted it, to seem to have made a correlation, seeing that they found the same bacteria in the gums as they did in the brains. And then I talked to another person who said, Madeline, really? No. And I said, why not though? It sounds believable maybe. Then there's someone asked me to ask you actually on our Facebook page that they've heard about supplements and the claim there, and then the relationship between aluminum. So can you spend some time trying to sort of unmesh these research studies? What do we believe? What do we hang our hopes on? And what do we understand in them, if anything?
Well, and that is the $1 million question. So research is the Alzheimer's Association. We are the world's, the nation's largest nonprofit funder of research. We're the largest.
How much, can I put you on the spot, how much goes to research from the Alzheimer's?
So we, last year was our most significant year to date, and I believe the figure might have been 30 million just from us.
Wow.
But I want to just unbundle. So one of the really exciting things, this is actually an exciting time in Alzheimer's disease research because just at the end of last year, Congress appropriated another $425 million to NIH for research. So since the passage of the National Alzheimer's Project Act, which was federal legislation that passed in 2011, Congress has quadrupled the increased NIH for research. So right now we get 2.3.
So they're listening.
Yes, they're listening. Not to us, the Alzheimer's Association, but to our advocates. So if you think about diseases like heart disease and particularly HIV and where those diseases were and cancer, and you think about the historical perspective in terms of what do people need, the first thing is more research funding to find out the causes and to advocate for better treatments while people are living. So that's sort of where we are in terms of a snapshot. It is exciting. In terms of the other questions that you're asking, the bacteria question and the gum disease question, there is some association around bacteria and viruses and Alzheimer's disease. None of it is a direct link. There's all kinds of things around virus, lifestyle, all of those things. Nothing is substantiated. However, more research is being done, but that study was not a definitive sort of a link. The aluminum claim, that's been kind of floating around for a long time. So that is not so much, but the supplement piece, that the FDA recently issued online warnings and advisories to 12 different organizations who were claiming to have supplements that were curative to Alzheimer's disease. And while it's exciting now, everyone's really paying attention to their health. People want to talk about coconut oil, and they want to talk about all kinds of other things. And believe me, we are very much, however people want to,
improve,
take care of themselves and their health. But, there is no supplement that's going to prevent or cure this disease. So we always make sure that we look at this in a more holistic sort of a way. So what's good for your heart is good for your brain. So we sort of look at this in terms of diet, exercise, sleep, all of the things that you do as you age, and stay socially active. That's another huge piece. Don't isolate, all of those things as you age. And again, it's not the magic bullet, but it will help you live a healthier, longer lifestyle.
Right. And can supplements have a negative impact?
Well, they absolutely can. I mean, and if you think about it, depending on what people are taking as they age, supplements can have drug interactions with other medications that somebody might be taking for, other types of diseases. And I'm not a physician, so I'm just saying.
You should bring it up. You should definitely, again, a note of warning to the audience. If you're thinking about a supplement or you heard something on TV, don't take it until you talk to your physician and put it in the context of all the other medication you're taking. Sure. You mentioned and you touched upon ways to protect ourselves. And I use that phrase lightly because we can't necessarily prevent. So the diet, exercise, sleep, stress reduction, those are all true about all diseases in a way, like you said. You do what's good for your heart, and it tends to be good for the rest of you. Are there other things, though, as related to this disease and Alzheimer's that helps, that aren't in that 4 categories that you have seen in your years of working with this population or advocating for support? Are there things that people do? Or?
Are you meaning in terms of prevention?
Yeah, prevention
So a risk factor that's an avoidable risk factor, believe it or not, is head injury.
Oh.
That is one thing. So we do have some information at alz.org/CT in terms of risk factors. Head injury is a big deal. Concussions. There is that linkage around dementia and that sort of thing. So, in terms of being safe, wearing helmets, all of those things. The NFL had commissioned a study years ago around this. So that's a preventable risk factor. Age still is the number one risk factor. There are some genetic components.
Talk about that. So if someone in your family has Alzheimer's, are you more likely to get it, or is it a genetic passed on disease? Or
so there's a higher risk for people who have it in their family, but that doesn't necessarily mean that you will develop. We can't say for certain. There are some genes, there's some very specific genes that are familial genes that people, it's shown. Very small percentage of the population.
Okay, so once again.
Exactly. So, when people are asking about what our thoughts are, and the Alzheimer's Association thought is on genetic testing.
I was just about to say that.
It's one of those things that, you don't want to panic people. And all of these things now that people do, like Ancestry.com and all of those things.
Christy, I agree. You touched on a really interesting point that I think, people are getting all these 23andMe results, and it's terrific to know more about yourself. But it is almost putting loaded information in your hands. Are you prepared to hear it and handle it? Because you don't know what you're going to find out. So you do have to look at that picture with an open mind and be able to at least, if you want to, respond to it and know what direction to go to. And you mentioned again, I'm going to plug your website again. If you're home, if you know somebody that you suspect has some issues or challenges, you can call the Alzheimer's Association and you could talk to somebody and say you need help for someone else, for yourself. Get on their website. Actually, I even printed something off from their website. All the statistics you'll see when you go on there, but it's a very easy, navigatable website, and so I would encourage you to get onto their website and learn more about what's going on and get involved. And speaking of getting involved, let's talk about the walk.
Absolutely.
Does the walk support research?
It does. It does. So, we do a number of fundraising events throughout the year, from galas to an event called The Longest Day to Walks.
I've been to your galas, actually.
Yes. So if people go to alz.org/CT, if they want to get involved to support an event, but I do want to touch, people can call our helpline, which is 800-272-3900. They can call if they just have a question or they want to know about geriatricians in Connecticut. information around
Good to
resources
know.
for home care, or if they have questions about.
How about day centers too?
Absolutely, day centers.
Because that's an incredibly important service gap filler. And I don't want to describe it as a filler, because Hebrew Senior Care has an incredible senior day center, and we have over 50 clients that use this 5-day-a-week program, and it fills an incredibly important role, not only for the people attending, but where I'm about to go next, for the caregivers. I've been working in the nonprofit community for 35 years, mostly as a fundraiser, until I got to Hebrew Senior Care, where I was able to expand my role. And the caregiving issue is something that has really struck me in my 12 years at this agency. There is a lot of important stories and information that you learn, but you see people being sort of torn apart by this disease, in that it changes their relationship. It doesn't just change the person. And making sure that you can still have meaningful dinners out, that you could still enjoy family holidays, which can become stressful. Talk to me a little bit about caregiving, the effects of this disease has on the caregiver, and your recommendation, seeing this. If you could give a message to anybody doing this right now as a caregiver, what would it be?
So don't do it alone.
Say it again, please.
And the thing is that, we run across the state more than 100 support groups, and groups for people in the early stage of the disease, couples groups. Caregiving is, can be the most stressful thing, but it also can be very rewarding. And there are moments of joy. There are people living well with this disease.
Exactly.
But it is to recognize that you can't do this by yourself, to get your family to help if you have family nearby, friends, resources in the community, alz.org/CT. Don't be afraid to ask for help. The disease can be challenging. People can live with this disease anywhere from 4 to 20 years.
And that's sort of the good news.
Right.
Right?
And so, but at the same time, if you're in it for the long haul, you want to make sure you're well supported, and the Alzheimer's Association wants to help the caregivers. That's what we're here for.
Exactly. And my personal message is, don't feel guilty.
No.
Don't feel guilty. I've seen too many caregivers in our line of work. They show their love and their loyalty through taking care of somebody, and just because you need a vacation, it doesn't mean you don't love that person, care about that person. And I know that's a hard message to deliver, because that's how you show your love for the person as you go through the disease progression.
I mean, if you think about it, they always say when you get on a plane, put on your own oxygen first before helping others.
Exactly.
And that's really what caregivers should do, and it's just a reminder for all of us.
That would be a great subtitle, slogan, tagline, if you will. Yes. That's what I was trying to get to for support groups, for caregivers, put on your own oxygen first.
Right.
As a reminder, because you need to take care of yourself so that you can be there to take care of your loved one and to enjoy what life is for the both of you. I want to spend a little time talking about this concept of dementia caring community. I think the Netherlands, as their country, has gone dementia caring, and we've got a lot of countries looking into this, and a lot of cities. Talk to me about this concept, because at Hebrew Senior Care, we're dealing with the families and the clients who are impacted by this disease. And I'm really interested in trying to get this community to think about this. So maybe this is something we can do together. So I'd like your input on this notion.
So it's actually really exciting. There's some organizations in the state that are doing things like Dementia Friends. There's the Livable Communities Initiative. And if you think about our state, which we are the 6th oldest state, Connecticut is, but you think about it holistically, what are we doing as a state to equip people to be able to age in place? So in terms of housing, transportation, access to services. What do those services look like? But look at it in a holistic way. And the models are sort of changing, so there's a lot of exciting things happening. But instead of looking at this in terms of just services, it's looking at it in terms of communities. And how are we designing communities where people of all ages want to be?
Exactly, and training is so important. I know that we do provide some of this, but I know through the Alzheimer's Association as well, you don't have to be a certified dementia practitioner to go through the class. If you're the head of a congregation, if you lead support groups for other people, and you just need to be trained, and you're dealing with this aging population coming forward. We all need to be a little more mindful of how this is going to impact our neighborhoods and bring it down to that street level a little bit. I know we could probably do a whole show on driving.
Oh, driving is huge.
Related to this topic, and it is huge. And how we're going to handle that, and because taking the license away is difficult. And having a backup plan, because we depend on getting out, we don't want seniors isolated.
Right.
So this is a topic that we could talk about again for another 28 minutes.
Right.
So hopefully I will have you back again.
Thank you.
I would love to. Real quickly, the walks, when are they coming up? You want to announce any dates while you're here?
You know what? If people just go on our website,
Okay.
alz.org/CT, all the walks for 2019 are posted. We have
Terrific.
7 throughout the state.
That's great.
So people can get on and get involved and
Terrific.
check out all of our events and our supports.
Terrific. And Hebrew Senior Care does do a walk to benefit the Alzheimer's Association. We go to the Rensselaer Field location. So you'll be hearing more about that. And I hope you'll join the Hebrew Senior Care team in support of what is an important and a wonderful cause. I really want to thank you, Christy, for taking time out of your busy schedule. I didn't even get to ask you about public policy. If I know I have like a minute, is there anything public policy that's coming up that you can tell us about? That's
we have a bill right now, so at the state capitol that's going to ask for training for physicians and clinicians for condition of licensure. So we'd love
so
people to get
important
involved.
because right now in our state, the 2014 report that was done by UConn about aging in our state, most primary care physicians are out of their element getting asked questions about this kind of issue or behavioral health or mental illness as it relates to seniors. So that's a good bill, good training. So that's terrific.
Fingers crossed. We're going through the process.
Thank you for joining us tonight. It has been a really jam-packed 28 minutes. I look forward to being back next month. If you have questions for Christy Kovel, please send them to me at jointhediscussion@hebrewseniorcare.org, and we will get your questions answered by Christy. In the meantime, if you have a guest that you would like to have on Join the Discussion, please email me again at jointhediscussion@hebrewseniorcare.org. In the meantime, thank you for joining us and have a great night. See you next month.